Okay, today's complication, and for the next 2 days, we're going to talk about pain and why that actually really matters in sickle cell disease. So when you and I think of pain, we think of something like falling down and scraping your knees, or getting in a car crash or something like that. And the thing with most of these pains is that they are controllable and they are something that your body heals over time. So when I fall down and scrape my knee, my body simply heals that and we move on. However, the thing we want to emphasize today is in sickle cell, it is not just pain like I have an owie. The pain is actually a message to our body that there is tissue damage occurring on the other side of that sickle cell blockage. So the fancy term for pain in sickle cell disease is a vaso-occlusion, which is a blockage within your blood. And remember that right on the other side of that blockage are tissues that are desperate for some oxygen. So they are not receiving that oxygen, which in turn causes pain and ultimately damage to that part of the body. So when a person living with sickle cell is talking about pain, they're not just talking about something aching or a type of pain that you and I have experienced. They're talking about a level of pain that people have described as worse than childbirth or 1,000 needles being poked into one spot. I've had one person describe it as a bullet lodged in a certain location. All of these really intense ways of describing pain because the pain is a result of the lack of oxygen going to the tissue directly on the other side of that vaso-occlusion. So tomorrow we will talk a bit more about pain. Check us out on the web at hopeforscd.org, and thank you for continuing this journey with us. If after the 30 days you're still interested, consider signing up for our electronic newsletter, which also features different videos and blogs about topics that you ask about. Stay tuned.